I think what we need to do is just stand up and just say what I think I was going to say at the end, but let's say it now. Workers united will not be defeated. Come on, let's say it. Workers united will never be defeated. Workers united will never be defeated. Thank you, Honour. Those of us who know my sister Aguila and I know that we were new migrants in the 1990s. And we were very lucky not to go through the uncertainty of the asylum system as it is now. We're also lucky enough to be placed in a B&B and then a council home. Inequalities existed then, but there was not just a bit more money in the public realm, but what really saved us was having a community. And this is what I really love and have loved about working in the NHS for the last 15 years and being a counsellor in one of the 10% most deprived wards in England, which is also home to 220 asylum seekers. That sense of community, which has been under attack. Atomised silos, privatisations, high levels of stress in making ends meet and survive, losing that sense of community that is so prominent within the spaces we work and our youth grow up in. With notable exceptions, we do talk of inequalities among staff and patients, working class communities, and then privatisations as separate. But they are part of the same story and multiple sides of the same 3D coin. I have seen this in painful technicolor, with the tentacles of the impacts of privatisation, atomisation and scarcity, with a backdrop of constant sowing of divisions within our multi-ethnic working classes. Men in my ward of North Brook live 15 years less than those in North Oxford. 9 children in a classroom of 30 live in poverty, the majority in working families, and up to 12 in a class of 30 if you look amongst black and brown residents and those with a disabled family member. The two arms of privatisation are spoken of as almost separate, but let me show you how they are the same. The Timor-Leste community in Oxford, they mostly live in houses of multiple occupation in the most deprived parts of the county, and some even have no recourse to public funds. These men and women are employed by the likes of G4S in my hospital as a cleaner, and they do not have the same pay and working conditions as the rest of us NHS workers. What is the impact on them of the more commonly spoken arm of privatisation? For example, the privatisation of our PET scanning cancer services, and it has further fragmented cancer diagnosis. It is for the very same men and women for whom English is a second language, who haven't got the social, time and monetary capital to manoeuvre our fragmented and stressed structures, that this has the greatest impact. This fragmentation and underfunding affects members of our Timor-Leste community in Oxford disproportionately. Health inequalities are now being actively embedded within a starved NHS, with the exclusion and marginalisation of some of the poorest people who are often in low-paid jobs living in some of the most deprived parts of England. A Windrush generation resident had been a victim of the hostile environment within our Kafkaesque immigration system. They had spent time in immigration detention and were struggling with impending homelessness. Many months passed, and when I was working from home towards the end of the second wave, expecting my second child, and helping ICU nurses with those terrible relatives updates, I recognised a critically ill patient's name. All I could do at that point was cry tears of anger at the injustice of the very same black resident who had suffered at the hands of our inhumane immigration system, then suffering the impact of the criminally mismanaged pandemic. As Martin Luther King put it, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. There is an asylum seeker hotel of perpetual uncertainty in my ward of North Brook. The residents speak movingly of being disposable to the authorities, which is also how the Windrush generation resident felt. The way the hotels are being allocated and mismanaged illustrates so many threads of fostering division that is dominant in our daily politics. Outsourcing with people treated as demanding clients and commodities rather than residents, paying scant attention to inequalities, placing more stress on public services in already deprived areas, and then blaming the individual asylum seeker fleeing persecution, the low-paid worker trying to make ends meet, and the often labelled under-delivering public sector worker. We have all come together, dedicated local NHS worker, the local GP manager, Claire is a hero, community activists, and medical students, to ensure health access and appropriate public health oversight at the hotel, and to demand changes from our local integrated care system, which has helpfully stated that tackling health inequalities is one of their key aims. And we are continuing to come together with hope to demand different and to build communities. This is because, for us, the dignified living of our patients and residents is not a far-removed political football, but a daily reality in which all our staff, all our patients and all our residents count. The NHS workforce plan, published 2 days ago, yesterday, is really a sad joke with absolutely nothing on how to retain our precious staff. And it is actually now scary, the number of staff who are leaving. And I don't blame them, because they have to save themselves. This is why we've all been striking, and this is why we must stick together, as enough is enough. So go out there, continue to stand on the picket lines with our striking nurses, our junior and our senior doctors, our posties and our teachers. Workers united will never be defeated. Thank you.